Hi, I'm Dr. V and welcome back to the channel. I'm sitting in my truck waiting for my wife, but you know what? I'm going to make a quick video talking about the piriformis muscle and why it can be such a pain in the nalga.
The what now?
That means the butt.
I can feel my lower back and my sort of glute muscles starting to kind of get a little achy. And it got me to thinking about the piriformis muscle, which is a muscle that is deep in the glute. It connects the sacrum to the femur. And when you're sitting for a period of time, that muscle starts to kind of get a little strained, and you might feel that almost like an antsiness in your leg. The muscle sits right on top of the sciatic nerve. When this muscle gets tense or irritated, it can compress the sciatic nerve, which can then lead to sciatic type symptoms. In fact, the piriformis is often referred to as a sciatic impersonator, but it's not really a true sciatic issue because it comes from the hip and not so much the lower back. And people who are sitting a lot, say after a long road trip, or if you're sitting in front of a computer all day, you're gonna start to notice that piriformis muscle starts to get a little vocal.
Hand muscles are gonna ache, sure.
So I'm going to go over some of the stretches that I recommend to my patients so they can help kind of release that tension in the piriformis and address another muscle called the iliopsoas muscle. So one of the things that I will instruct my patients is to stretch out the hip flexor by basically standing on your feet with one foot behind the other, about 2 feet back, and your back straight up and down. Do a lunge. The leg that's on the back side is the one that is going to extend the hip and stretch out that iliopsoas muscle. All my stretches, I'll tell my patients, just hold it for 10 seconds. Do it 5 times on each side. Now, going back to the piriformis, the way I tell my patients to stretch this one out is for them to lay on their back with their feet flat on the ground. That's your starting position. And then you bring, for example, if I wanted to stretch my right side, I'll bring my right ankle up and cross it over my left knee. So now they're in this sort of figure 4 position while they're laying on their back. The opposite hand, which would be my left hand, will reach over, grab the right knee, and just basically bring that knee up towards your chest and towards the opposite shoulder. This will stretch out, you'll feel a stretch. So this will stretch out that piriformis muscle and some of the other muscle groups that are responsible for the external rotation of the hip. Same thing, hold it for 10 seconds, do it 5 times on each side, and if you can, do it throughout the day. In about 10% of the population, the sciatic nerve will actually go right through the piriformis muscle, not leaving a whole lot of room for any sort of freedom of movement of that muscle without irritating or compressing that sciatic nerve. So this group of people tend to be much more symptomatic or susceptible to developing piriformis syndrome. So if you like this information, if you like hearing these sort of health tips, just give us a like, subscribe, and hit that little bell notification. I'll see you guys next time.